Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast. You are joined by your hosts, product manager Parker Anderson and
founder and CEO and child psychiatrist Tom Tarshis.
I would say that was a successful new intro.
I think I'll cut down the number of things I say before my name next time, but I thought we did pretty good.
I think we did well. How is it going, Dr. Tarshis?
Good. It's busy, but you always want to be busy versus not busy. So that's what you're going for in your practice and business.
Yes, I very much understand the feeling. Today, we wanted to talk about a topic that we think is very relevant to a number of providers. I think it has to be a universal experience that everybody comes across, whether you're currently in a private practice or at a group practice, or even if in your practicum training. It's just something that happens to every provider, which is cancellations and no-shows. So I have a list of pretty good questions on the topic. I think the first and most important is just, what's the impact? How do cancellations and no-shows impact mental health practices typically?
Yeah, no, great question, and something everyone, regardless if you're, private practice or small group or large group, has to deal with is when patients don't show up or cancel at the last minute. Where everyone in this field is in a service industry, so that means you need to provide the service to get paid. And that means you need your patients to show up, so you have someone to provide the service to. And you can imagine that if your business goal is to see 30 patients a week and 10 of those patients canceled, or even 5 of them canceled, that's going to have a significant impact on your business and how you can bill. So definitely need to have some policies in place and to figure out how to deal with no-shows and cancellations. It is for Medicaid patients, you're not allowed to bill for no-shows and cancellations. So I think it was one thing I just wanted to throw out. We do some community work for some community-based organizations. And people who are on Medicaid, or in California it's called Medi-Cal, there can be a lot of issues with getting to appointments on time. And even with telehealth, there is a high no-show rate, and people who are on Medicaid don't have the funds to pay no-show or cancellation fees. So there's some different strategies you have to think about if you do see a Medicaid population. But in general, whether you take insurance or you're cash only, you can set cancellation and no-show policies to protect your business's financial income. Yeah, and that's what we're going to talk about today, and that's why thinking about cancellations and no-shows is a very important component to your business plan.
Yeah, and we'll get into some more specific policies a little later on. I did want to quickly touch on what you said about community organizations that take Medicaid. What does the impact look like on that if you can't charge for those no-shows?
Yeah, and depending on the policies, in most states, Medicaid is a state-run program. In a couple of states, California and Texas, it tends to run through the counties that then go to the state. And the agencies that get the contracts for working with Medicaid clients, there are stipulations on that money. And there does tend to sort of be a lump sum to cover some of that. However, you're still mainly get paid by seeing those patients. And so what tends to happen for a lot of those agencies is they hopefully are tracking their no-show rate. However, in general, can be up to 50%. So a lot of entities that take a lot of Medicaid will resort to double booking. So they are going to assume that 1 out of every 2 patients is not going to show up. So you book 2 patients into every time slot, and then it becomes organized chaos if you have a day where all your patients show up. And it's also not a great experience for if 2 people show up at the same time, one of them's going to need to wait to be seen. But if you're faced with that's the only way you get paid, a lot of people who work for the community-based organizations understand that there can be days like that. A couple tools we've thrown into RipsyTech to help manage this whole issue is you can look at no-show rates. We track them by patient. So you can look at what a patient's no-show rate is. And we also track them by provider. So you can look yourself as, what is my overall no-show rate? And this has been helpful for some larger practices who can see the reality is that some providers tend to have a better show rate than others. And so you can track it from that level. Or just individual patients. If you see a patient has never no-showed, you can feel pretty good they're going to show up. And if you see another patient has a 70% no-show rate, it can just give you a little heads up that they might want double reminders or a personal phone call or emphasis from the provider. Hey, make sure you show up to the next appointment. So we try to give some tools to help deal with this important issue.
Yeah, you're touching on something that I was thinking about asking, which is, strategies to reduce the frequency of cancellations. If it's something that becomes a bit of a habit for one of your patients, what is the appropriate next step to take as their mental health provider?
Yeah, and that's can be a very complex question. Is this a patient who's coming once a month or once every other month for a medication refill? Or is this a weekly or twice weekly therapy patient? There's different strategies depending on what type of patient it is. Especially for therapy patients where, this field in general, people are uncomfortable talking about money and then having to bring up to, I think a lot of patients may not realize that when they don't show up, that is affecting the income of the provider that they're seeing. And, therapy patients tend to get regular weekly hours assigned to them. And if you work with kids, like the afternoon hours are prime scheduling time, and it's very hard to take a hit having your 4 to 5 spot with someone who cancels a lot. And so what it means is healthy and good communication around figuring out any time someone cancels or no-shows. One recent change that's been nice, Parker, is since the pandemic and telehealth becoming ubiquitous in this field and still being able to be reimbursed for, if a patient is late or forgets about an appointment, you can quickly get a video link out to them wherever they are and say, listen, let's do the session and you pay your copay, or don't do the session and you've got a large no-show fee to deal with, which we'll talk about cancellation or no-show fees, but which also begs the question of what type of entity you are. So if you're like a solo practice and you have a patient who's not showing up, pretty quickly you want to try to reach them and you can try to make it a telehealth session, and then it saves the patient any no-show fee and lets you see them and do your billing. If you're working for a larger group as a clinician and your patient doesn't show up, there is a little incentive to get that 45 minutes or hour free to do what you want if that right. doesn't directly affect your paycheck. So there are different strategies if you're managing a group versus, if you're a solo practice.
Now imagine if you're if you're part of a large group of providers, if if it's a large popular provider that is very in demand and a patient is commonly missing their appointments, is it, I imagine it would be more likely that group would have some kind of policy in place, to maybe provide a referral for that patient, or I'm not sure what would be the proper next steps for something like that when that's an organization that has really high demand and needs to be able to provide services to as many people as possible.
Yeah. And I think in general, it's most office policies will be very explicit about cancellation window, no-show fees, and we can talk about some examples of that. The decision to sort of kick someone out of a regular spot or change the frequency you see with them, it's usually generally written into office policies that if you miss a lot of appointments, your care provider will be having a conversation with you regarding your treatment plan. And that piece is kind of left to more individual planning between the patient and the provider. There are certainly rules around, especially if you're a prescriber and someone's taking medications, around the minimal frequency that you feel comfortable seeing someone to prescribe medicines. And the answer there is, if you don't see me once a month, you're not going to get your prescription. And that can tend to be a motivator for people to show up to their appointments if they need their medication. But it can get into issues of good care, and you don't want to keep renewing prescriptions from people you don't lay eyes on and have conversations with. So there are a lot of nuances that fall into play with patients that don't show up often. Definitely in my years of doing this, there's a pretty decent number of patients that have had to be terminated because of their inability to make it to their appointments.
So before we move on to some more specific types of policies that somebody can implement, I was thinking of skipping this question, but I actually do think it would be important to cover, just kind of to build some empathy and understanding for why somebody might be canceling, and that really is just what are common reasons for canceling or a no-show.
Yeah, and I think we've all had dentist appointments or primary care appointments, other sort of scheduled appointment, restaurant reservations.
Right. Accidental double booking.
Yeah, and so the reasons are very variable, and there's sort of always the emergency reason where, you're in a car crash on the way to the appointment, or you or your child are sick with a fever, and like that. In general, having an emergency clause for cancellation and not penalizing people for that is a smart business move. That being said, yeah, the reasons are just very, very variable. And something that tends to happen in mental health treatment is, people will say that if a patient is missing a lot of appointments, then they're probably either doing much better or potentially they're doing much worse. So what is the case that's happening with your patient? So when you're feeling pretty good, all of a sudden showing up for your weekly therapy, maybe that new movie that came out and your friend said, hey, let's go check out the first matinee, right? That could be motivation for, hey, yeah, I'm doing pretty good. I'll just skip my therapy appointment. And if the policies haven't been made clear about the cancellations for your therapy appointment, that can be an issue for your business. Mental health treatment, because it's more frequent than something like a dentist appointment or primary care appointment, does need extra thought around the no-show and cancellation policy.
Yeah, that's a great point, because I imagine because of the frequency of appointments, it's much more important to have that laid out because it can just happen so much more often. The dentist, as a patient, you kind of know if you can't make it to your dentist appointment and they schedule these things 6 months out, you kind of just have to take what you can get. Hopefully it's not another 6 months out, but certainly when it comes to seeing a provider that you see as frequently as 3 or 4 times a month, that having their schedule might also be a little bit blocked up. So it does seem like it's important to keep in mind also, I guess if you have a weekly session already set up, you can just see them the following week. But I guess really I'm just agreeing with everything that you're saying.
Gotcha.
So let's get into it. What are some good policies that a practice can implement to handle cancellations, no-shows, while still making sure that they're maintaining a positive relationship with their patients?
Yeah, great question. And there are lots of different strategies we've used over the years, and I'll sort of try to throw out different ones. And again, depending on other size of practice and employees and things like that, there are many options that can be helpful. I'd say the first piece is when a patient's coming to see you, you need to have office policies. And within the office policies, you need to include some HIPAA language, and you need to include some consent for treatment language. Over the years, we used to have many different policies for people to sign, like consent to treatment, office policies, payment, a separate no-show policy. But what I found over the years is I think it's easier just to put it all into one document. So within that one document, including everything that's needed, but having special attention to the no-show and cancellation policy is what we try to do. And, for example, we have a 48-hour cancellation policy. We try to make that very clear. And currently in the clinic, the fee for cancellation varies depending on provider level. Where for a master's level provider, it's $100 fee for a no-show or late cancellation. For a PhD level, it's $200, and for a prescriber, it's $300. The reason we have those fees in place is so the business still does lose money because that's lower than other reimbursement rates, but it helps capture money to at least maintain the salaries of the providers. And so that, and then everything is sort of signed digitally now. So when people are signing it, we have them initial these fields. However, as you know, when you're doing these electronic initial here, sign here, even when they weren't electronic, people are rarely reading what they're signing. They're not always reading, these policies. So if you really want to do the right thing, you need to, at that first session, have your admin or yourself have a conversation about the no-show and cancellation fee and let people see what they've signed. And it feels much better to have that conversation and prep people than they have their first late cancellation and they're like, what do you mean it's $300? It's like, well, here's where you initialed that you agreed to this. And then, well, I don't read that, and et cetera, et cetera. So as we're in the therapy field, having a conversation about that is helpful. I'd say that we've experimented with doing things like giving people one free late cancellation or no-show for any reason in a year period. We certainly have a emergency excuse. However, we're pretty strict about that. Like, if it's a car accident or something, of course, but we don't let people say they're sick. We require a doctor's note sort of documenting that they're sick because it unfortunately is too easy to just call in and say you're sick to get out of your no-show fee. So we kind of make it like a school or work policy. Okay, you're sick, that's fine. A lot of companies have, where's your doctor's note if you're going to be sick?
Right. But in this case, it's the school might do that because it's a way of encouraging, good attendance. But in this case, it's really about helping to continue supporting the business and making sure that the business can, afford its own bills.
Correct. And also, wanting to make sure that if people are on a schedule for their treatment, that they are consistent with that schedule also. But
right.
Yeah. This is really, there's some piece of this around care compliance, but it is really more of a business discussion. And I would say what we've alluded to is as our number one strategy for no-shows is calling them if they're not there within 5 minutes and trying to switch it to a telehealth session. And sometimes this is, you can bill a therapy session as long as you're hitting 16 minutes. And if you're a prescriber, you can bill E&M codes based on complexity, even if it's a 5-minute visit. So if you can get the patient on the phone, or even if they're going to not answer the phone, you can leave a message, or if you have texting abilities, hey, if we can do a 20-minute check-in, you can avoid that no-show fee, tends to be a powerful way to engage people who have planned to no-show. So kind of stopping the no-show in its tracks. So those are some policies that we have in place.
All right. Excellent. The final question I had, and we might have already kind of talked about it, but I'll reiterate the question in case anything else comes up, is how should a practice communicate its cancellation and no-show policy to ensure patients understand and comply with it? You've already touched on the admin. What if somebody doesn't have an admin? What if it's just you? I suppose it's, first session, still an appropriate conversation, but does anything come up for you?
Yeah. And we still try to have the conversations. We, in RipsyTech, we have sort of custom messaging that you can send to patients. And, we have the reminders to sign your office policies. I've thought about putting in, general reminders around the no-show and cancellation policy that can go out to patients. We work to set appointment reminders out both 72 hours ahead of time as well as then the day before. So that can be a nice reminder for people. Oh, yikes. I forgot I can't make this week. And so we're giving them a reminder before a 48-hour cancellation window. I would say that if you're a private practice, it's very reasonable to not have a 48-hour or 24-hour cancellation window. And there are lots of providers who, if you have a weekly spot, you're paying for that spot whether or not you show up. And then that's something that needs to be in your office policies and discussed with patients as well. There is a special case, which is first intake appointments, where, people have signed stuff, but they haven't shown up to see you yet. We've definitely done different strategies, such as taking a deposit before that first appointment that will then be applied to the visit charges or copays. And that is a very effective strategy for making sure people show up for that intake appointment. Because those have the highest no-show rate of all appointment types, is those initial intake.
That makes sense. So before we started recording, we were talking about how somebody's insurance plan might play a role in this. Is that something you wanted to touch on?
Yeah, and I think, the question is around, not wanting to damage this patient-clinician relationship, but needing to face the realities of running your business properly. And it can be, right, money and sex are the hard things for everyone to talk about. So telling someone they owe no-show fee that can be, $50 to several $100s, or sometimes it's relevant even for just collecting your payments from your patients. If you're a cash practice, or if a patient has a very high insurance deductible plan, you need a comfort and strategy to be able to tell families, hey, they owe you maybe thousands of dollars. Even though payments and other links can be automated, and here's what you owe, every practice is going to face patients that don't pay their bill. You can implement strategies like getting a credit card on file, like giving a lot of frequent billing reminders, but this still is not going to prevent you from having patients that aren't going to pay. And because you are a clinical provider for them, there are nuances around patient abandonment and treatment options. And yeah, it is not good for care. It's not good for you knowing there's this patient that owes you thousands of dollars, and that affects your income and life, and is consciously or not going to affect the care you provide. And it's uncomfortable for them also. So it all sort of falls back on that being careful about communication, setting a clinic policy around, once a patient owes X dollars, maybe pausing care until they've paid that X dollars. And it's much easier to try to collect $250 or $500 versus $1,000 or $1,500.
Right.
Being flexible with payment plans, so having people pay things off over time. And then we'll do another episode on payment strategies and some of these other topics, but it is sort of all tied into the no-show fees and cancellations and managing the awkward conversation of payment.
It makes me think about what would be, say you do have a patient that no shows and they do owe you money. Is it, you're talking about pausing care at a certain cap, but does it make sense from a simplified perspective, if somebody wants to have like a very simple, straightforward policy around no-show fees, does it make sense to say, like, you have to pay your no-show fee before the next session? Or I guess, how would somebody think about navigating that?
Yeah, and we've had at different stages of larger clinics I've been at, that has actually been a clinic-wide policy, that if you haven't made a payment towards your no-show fee or worked out a payment structure, we will not schedule your next session. When it gets to that point, it's important to let the provider know that, hey, your patient can't schedule till they pay, and maybe you can reach out to them as well. And, having the ability to take partial payments so people can continue their care, I think is important also. But there definitely, sometimes it is out there in the clinical world that, well, you can't abandon your patients, so you have to keep seeing them if they don't pay. No, that's not really true. You're a service provider and you don't just work for free. And if someone has not paid the fee that you owe them, there's some issue. It is definitely easy to pause therapy. If you're working with a very sick patient that needs medicines and is at risk for harm, is an obligation maybe to be there to hand off care and figure out some other solution. But you don't need to keep providing free care to people who haven't been paying their bill. That's just, that been talked to. If people have concerns about that and the legality of that, everyone can always check with the lawyers at their malpractice insurance. But there is nothing written that says no matter what, you have to keep providing care to a patient that hasn't paid your fees.
Yeah, and I imagine as a provider, it is a difficult pill to swallow for sure.
Yeah.
All right. Well, before we move on, are there anything else on the topic of cancellations and no-shows that you'd like to touch on?
Oh, just to mention one other strategy that I forgot to bring up around cancellations is we would often offer, if you can reschedule within the same week, that then we would waive the no-show or cancellation fee. Because often providers, and this works well if you have, providers don't want their patients to get hit with a no-show fee. And often you've got some other open blocks from some other patient that was on vacation, or, maybe you're willing to give up half of your lunch hour to squeeze a patient in to see them and generate that revenue. So that can be a very effective strategy, as well as is allowing, if you can reschedule and get in the same week, that will waive the no-show fee.
Yeah, actually, that just made me think about, I'm not sure if we touched on this, but for cancellation policies, does it make sense to say 24 hours, 48 hours? What have you found to be the most effective?
Yeah, probably one of those. The nicer thing about 48 hours is that does give you time to potentially bring in a brand new patient to your practice. Right. If someone, gives time for someone to complete registration and office policies and put a new patient in there. 24 hours, if you have even if you have a long waiting list, reaching out to someone, sometimes it's hard for them to respond right away or grab that 24-hour spot. Busy practices, often you may have another list of patients who need an extra appointment, that those can sometimes establish patients you can fit if you have a 24-hour notice. So it all sort of depends on the size of your clinic. Are you solo practice? Do you have other clinicians working for you? 72 hours just feels a little bit far out for the cancellation policy and isn't good for your business.
I would agree.
Yeah. I think the smaller your business is, the shorter your cancellation policy should be. Yeah.
Yeah, I think that makes sense. All right. Well, shall we go ahead and are we ready to move on?
Yes, sir.
All right. Great. So, mental health business moment of the week. What do we got this week?
Yeah. This is always lots of things to think about with the business moment of the week. Something affecting the practice. I'd say the one thing as we've been able to work towards automating insurance payments, including automating the electronic review of payments and explanation of benefits, it's very interesting to me how some insurers get their information to you right away, and several days before you're even paid, you know what's going to happen. Whereas other insurances, money has shown up in your bank account, yet they haven't submitted the electronic remittance yet. And so we've just been having some frustrations with realizing, different insurance companies are on different schedules for electronically putting in some of the remittances for payments. And that makes it hard for us to standardize some of our documentation and be concerned, like, hey, was this a EMR error? And, oh, wait, no, they're just 48 hours behind the competitors. And so that's been causing me slight headaches just figuring that out this week. And it will be, in this billion upon billions of dollar systems with the healthcare insurers and outdated software behind some of the insurers, it makes sense that there would be these differences. But
right,
where we're trying to make everything as simple as possible for our clients, it's too bad we have to account for inefficiencies among big insurance companies as we try to make things easy for our clients.
Right. Well said. Well said. All right. Well, I think that about wraps things up for this week. Go ahead, and if you'd like to submit questions to our podcast, I think we can do a Q&A grab bag episode a little later on, as we maybe get a couple more questions in. But go ahead and send questions over to sitandstay@RipsyTech.com. We would love to answer your questions. And we also post these episodes every Wednesday, and we put out an associated blog post the following Monday. So feel free to check out our blog at RipsyTech.com as well.
Awesome. Thanks, Parker.
All right. Have a great week, Tom.
Bye.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.